Good afternoon. My name is Carla D'Imperio, and I am the Director of Family Support for the Phelan-McDermid Syndrome Foundation. I'm also mom to Matthew, who he's about to turn 10, my 9-year-old son who has Phelan-McDermid syndrome. And we live in just outside of Tampa, Florida. So I'm really excited to be here with you all today. I'm looking forward to discussing this really important topic of medical advocacy and strategies. This is the third in our Pathway Education webinar series. And I think so far, we've had really great attendance on these webinars. We're trying to present topics that are really going to support you all as parent caregivers on your pathways to helping your children and adult children and just being the best supports you can for them. Okay, so let's get going. So what do we mean by medical advocacy? In the context of this session, we're talking about supporting and promoting the rights and interests of patients in this case, your child or adult child who has Phelan-McDermid syndrome, and ensuring that that person receives quality care. Medical advocacy might include advocating for healthcare systems and policies. That's a term we see a lot, bigger picture, lobbying and changing legislation. But that's not what we're talking about today. So today we're really talking about advocacy in the context of your own child's medical care and how you can support them on that path. I want you to keep in mind throughout this hour together, all of this can really look different depending on, the season of life that your child is in, the age of your child. Like I said, my son is 9, and I did plan this session with the input of Diane Linehan, who's on our staff, and her daughter is in her 30s. But really, my perspective is of being a parent to a 9-year-old. So, I think that that's just important to keep in mind, that some of the topics we talk about will be different depending on the age of your child, which state or country you live in. There's things that just vary based on geography. Another thing that will sort of affect the experience is whether you're in a rural or urban area. Obviously, that affects access to hospitals and care. So that, might just be something to keep in mind. The insurance you have, that can definitely have an impact on your ability to choose medical professionals. So in a nutshell, what we mean about medical advocacy for the purposes of this session is getting your child or adult child who has Phelan-McDermid syndrome what they need, the best care possible in a medical setting. Okay, so for the building blocks of medical advocacy, the first thing that is really important to do and solidify is to assemble a care team for your child. And in some cases, a lot of times, this is just kind of who you've worked with along the way and who's been recommended to you, and maybe it has not always been intentional. And there's a lot of people involved in a care team. So I have the patient at the middle. That's going to be the person with Phelan-McDermid syndrome, and then all these different people around on the care team, including specialists, so neurology, GI. For those of you with adults, maybe they have home health workers or caregivers at home, or maybe they're in a different type of residential setting. So there's a home here. School team, there's the hospital team if you have an inpatient stay. That could be an inpatient stay for a period of illness or an injury, or it could be for a psych issue. And then we have all these different therapies, so speech, OT, PT. The pharmacist, that's someone who's on the care team. That's someone that you can build a relationship with and leverage to advocate for your child. We have this one, the runner over here. Diane added that one because she always has someone at her appointments with her that can help with Courtney and can often spends time chasing her and following her around. So she had me put a runner there. I'm sure some of you can relate to that. Hospitals often have a medical advocate that they can provide to you for free. So that's someone you can add to the care team. And then this is the parent. That's you all, parent or guardian, the primary person responsible for the child or adult. And then on the upper right-hand corner, I have this one in a different color. For Matthew's case, this would be the primary physician. And what this person is, the reason that I have them in a different color is because they're what we're going to call the care quarterback. So that is really the person who is your trusted person that you go to for support, that really listens, that is willing to look at Phelan-McDermid syndrome resources and learn. So think about in your mind who that person would be for your child. That is a really important member of the care team. And I am calling them a quarterback just to keep it something you can remember. They should be a great listener, someone you can really talk to and feel like they hear you, willing to learn and talk to other professionals, willing to connect with other professionals. So as your child gets older, if you have an adult child, maybe there's been some psychiatric issues, we have a whole group of doctors who your child's doctors can consult with, but the doctor has to be willing to do that. So that's a really important quality to look for in that care quarterback. Willing to use our resources. We have a ton of Phelan-McDermid syndrome resources as a foundation. So doctors that are willing to look at them and use them to help with supporting your child. That's really important. Fairly easy to get in touch with, within reason. Can get an appointment fairly quickly, like for Matthew. And I do know it's different with a pediatrician, but we can get him in the day of if we have to. If he's sick or if there's an emergency, he will be able to be seen that day. And to me, that's very important. That they're connected to a hospital, so they don't have to be in a hospital practice. They don't have to have the most, fancy high-tech equipment, but it should be someone who's connected with a hospital, can look at records in a hospital, has a relationship affiliation with a hospital. It's the person in charge of the care, the person kind of coordinating care. This quarterback does not need to be a Phelan-McDermid syndrome expert. They need to be willing to learn and listen and work with you, but they don't need to be an expert on Phelan-McDermid syndrome. So I think that's a really important point, because it's nice when we can have specialists who are experts on Phelan-McDermid syndrome, but the fact of the matter is that there really aren't very many doctors out there that have ever treated someone with it. So I think that's just something to keep in mind. And based on all of this, sometimes this person, it's like a unicorn doctor, and you might not have access to a doctor like this. So that means that this person might have to be the parent. That the parent might have to be the person really coordinating and managing the care, talking with all of the different medical professionals. This means the doctor, if they're that quarterback, they've got to be willing to put in extra time that they might not be paid for to talk to other medical professionals and manage your child's care. So some people aren't willing to do that. So sometimes it will have to be the parent. Sometimes it will have to be you. Flags here, and we're going to talk more about some of this later, but if the doctor walks in the room looking on Google and reading about Phelan-McDermid syndrome on Google, probably not the person you want as the quarterback, because you want someone who's going to ask you if they don't know, if they've never heard of it. They're going to admit that and say, I need to learn about this. Can you help me learn? If they dismiss your concerns, our kids often have really unique issues, and as parents, we observe them and we understand that, we have kind of a gut feeling about our kids, right? And if the doctor dismisses that or doesn't take that seriously, that's a big flag. You've got to see, I've got my football flag. You can throw your flag. If they don't acknowledge your child, if they don't speak to your child, if they don't talk to your child before they start examining them, and when I say child, I mean adult child as well. So to me, it's really important that they're treating Matthew with dignity and that they see him as a person and an important part of his care. So we'll talk more about that later, but those are all flags that mean that that person probably isn't a doctor that you really would want on the care team at all, but definitely not someone that you would want to be sort of that care quarterback. Let me see if there's any questions. All right. And in my polling questions at this point, I had a question about, do you have a care quarterback? Is there someone that you feel would be a trusted person that does this for you? So if you want to put that in the chat, I will open the chat up and take a look. The chat should be working. Let's see. All right. I think it should be working now. But for me, for Matthew, his care quarterback is his primary care physician that we're very fortunate to have. He has a small practice. It's just him, it's his wife and his sister-in-law, and then they have a couple of nurses, and they've been excellent for us. They're not experts on Phelan-McDermid syndrome. He will get out literature. He'll read. He'll write. You know, if Matthew needs a piece of equipment, he'll help us with the scripts for that. He's written letters for Matthew. He's really a champion of Matthew and has made a huge difference in his life, but he's definitely not an expert on PMS. So if you want to pop anything in the chat about that, feel free. So, okay, so we've talked about assembling the care team, identifying a care quarterback, and then this third building block of medical advocacy, which we're really going to spend the bulk of the time on, is building your skill. It is a skill. It is something that you can learn. It's something that we are in control of a lot of, is how to really get your child what they need in a medical setting. So there's a bunch of strategies here that we can look at. The strategies are basically, you know, pieces of these skills as advocates. Trust your gut. So that's really, really, really important. And we've touched on that already. But if you feel like something's not right, if you get a funny feeling about someone, or if you think your child has some kind of an issue and no one's taking you seriously, you've got to listen to that. And you've got to kind of learn to listen to yourself, because so many times, you know, as parents of people with disabilities were often dismissed or not listened to the first time. So it's almost like training yourself to hear that. If something feels off, it probably is, and you know your child best. I think that being said, it's also important to remember that the doctors who have been with your child for a long time, they know your child as well. So for example, when we do have families that consult with our neuro psychiatric consultation group, the reason the prescribing doctor consults with our group is because that prescribing doctor actually knows the individual, right? They're the ones in the appointments. They're the ones that see them in person, prescribe their medications. So even though our neuropsychiatric consultation group from PMSF has expertise in dealing with neuropsychiatric issues within Phelan-McDermid syndrome, they don't actually know that individual. So it's really, really important to, you know, take all of the resources and supports that we have as a foundation, and then layer in that individual support of the doctors that really actually know your child. And then along with your own, you know, your own gut feelings about things. Educate yourself. So that's pretty obvious. I think if you're on this webinar, that's something that you already care about. You're taking time out of your day to learn more about how to, you know, accomplish this with a PMS diagnosis. We have so many resources. I will send you all a lot of them after the Zoom. I'll send you an email with all of the follow-up and all of this information, but we have so much available that, you know, you can look at and learn about Phelan-McDermid syndrome and share with doctors. So you've got to become the expert. Nobody else is going to do that for you. I think that's a really important point, is at the end of the day, you know, doctors will come and go, therapists will come and go. We've had so many great therapists that then they go on to do something else, or they go work in the school system, or, you know, have a baby, or whatever the case may be. And they come and go out of Matthew's life and they make their impact, but the parent is still there, right? Through the whole thing. I'm the constant, my husband is the constant. So nobody else is ever going to care as deeply, ask as many questions, and learn as much as the parent. I think this one's really important, balancing trust with skepticism. So, you know, most of our doctors, most clinicians genuinely want to help people. They want to help your child. They want to provide good care in general. So, we want to trust our medical professionals and at the same time ask questions. And if something feels funny, be curious and seek better understanding. If you don't understand something, pause them and talk about it. That's okay. Um, so we're trying to assume the best of the people we're working with and also ask questions and be curious. I think that's a skill too. That's something that doesn't necessarily come naturally, that you've got to kind of keep in your mind as you are in appointments. This one's really important too. I seek help and support. We're very fortunate with our community to have such strong connections amongst our families. You can always throw ideas, throw them off of other families. Um, you can come to us as a foundation. There's a lot of support that we offer families. We have our support groups. We have the neuropsych consult group. Um, there's a lot of different programs in place to support and help families. We have genetic counseling. There's a lot. So if there's something you feel like you're at a dead end and you don't know what to do and you need help, bring it to us. Reach out to me, and I'll try to help you and point you in the right direction. While not a Phelan-McDermid Syndrome Foundation group, we also have there's also the 22q13 support group on Facebook that a lot of parents ask questions into, and that can be a good resource if you just want to pick the brains of other people and hear their experience, their anecdotal experience. And don't be afraid to bring someone along with you on doctor's appointments. Some of our families always bring someone along to take care of their child, watch the child, make sure that the child is occupied, safe, adult child, either way, so that they can really listen to the doctor, take notes, and they can really remember and report on what's been happening, in the interim since the last appointment, or if it's the first appointment, they can really be a good reporter. That's often not possible or very challenging if you're also wrangling your child who has Phelan-McDermid syndrome. I should take my own advice on this because I really don't have someone accompany me to appointments, but I think it's something I should think about for sure. I know there's a lot of families that do though, that's what they do. I think that it's important also to just kind of recognize that is kind of a privilege, that not everybody has someone they can bring or is able to do that. So, and then I think this last one is really probably the most important one, and we'll get into it more, but building enduring partnerships. So you want to build positive relationships with the people that are involved in your child's care, whether it's people you only see briefly because they're doing a blood draw or it's an ER visit, or if it's a doctor that you're starting out with that you're going to be with for years and years. Either way, it's important to look at that as a partnership that will ultimately better your child if it's a positive partnership, and put in the energy and the effort to try to build that relationship from the start. So one lesson in this too, and this is sort of the same when you're talking about IEPs or that kind of work as well. You're going to see the same people again and again, right? So if you go to the ER and you're screaming your head off and getting hot tempered, and raising it to I need to speak to the supervisor or whatever, when you come back to the ER in a month or two, it's probably going to be the same supervisor. It's the same people. They don't go away. So, we want to think about the entry point of being able to be respectful, collaborate with the others, collaborate with the doctors. And often the people that are in those higher positions are the ones that really don't turn over as quickly. So they'll be around for a while. It's the same within IEP work, with whoever is the director of special education for the school district. They're probably going to be doing that job for a while. So think about them as a partner and how you can leverage that partnership. You need to be a listener too. So we want the doctors to listen to us, but we also need to listen to them. Even though we're the experts on Phelan-McDermid syndrome, or we probably know more about Phelan-McDermid syndrome than the doctors do, they still know more about a whole lot of medical stuff than we do, right? So we're listening to them. We're giving them the time and space to talk, ask clarifying questions if you don't understand something, and really make sure it's not a one-sided conversation. If things are getting tense, take a breath, relax. We'll talk more about some strategies with that, but sometimes conversations do get uncomfortable, and that's okay. You can still, pause and move forward. And I would say for me, I think I do a really good job of building partnerships with folks. My husband and I kind of play good cop, bad cop sometimes, and I'm usually the good cop. And but also you've got to remember, what's the purpose of this partnership? Why are you going to chit chat with the nurse or try to make them, be friendly with you? Well, ultimately it's to get your child, the best care and have people listening and move your child's healthcare forward, right? So I think that's important to keep in mind. I think for me, something that's harder is probably seeking help and support. Like I said, we don't bring others to the doctor's appointments. We kind of try and go it on our own. And in preparing for this session and speaking to Diane, who said she always brings someone for Courtney, it makes me wonder, maybe that would make me a better advocate for Matthew if I took the time and kind of put myself out there and asked someone to come with us when we go to doctor's appointments. I will say my mom has been a hero at many a dentist appointment with me and my 3 children, which is like a zoo. So I know she would come with me if I asked her. So think about what's harder for you. Which of those things does not come as easily to you? And if you want to put something in the chat for me to share out, I'm happy to do that. All right. I think that, so the next part of the presentation is going to be getting into more really specific pointers about different settings. And so as we sort of start to talk about that, I just want to make a few points about transitioning to adulthood, because I think it does look really different for adults with PMS, or adults, in general with a disability where they're not able to be their own guardian, be in charge of their own care. Excuse me, versus children. So I'm still in this world as a mother and as an advocate where my son is a child. And so we are still kind of living in that. It's a little cushier, I think, right? There's some things that happen as the child gets older, and once you enter the world of adult care that are just a little harder, or a lot harder. So some things to think about if you have a child who's getting close to 18, those teenage years, even younger, it's important to start thinking about this stuff. For that transition, you want to make sure you've compiled their records, that you have a handle on childhood records, like the most important medical pieces. Not every single thing, every single paper, but big tests they've had, big procedures they've had, surgeries, hospital stays, all of that you have good records on your child, in case something gets either lost or transferred incorrectly. You want to make sure you have that. You want to know how your child's doctors handle that transition to adulthood. So at what age will they say you have to go find an adult provider, versus staying with the pediatric provider? So we're not going to get into this super detailed, but I just wanted to raise these points. I think they're important to think about. You can ask for the hospital policy if it's a hospital practice, or the clinic policy, or you can just ask the doctor themselves when you talk to them. I know, like for Matthew, we've already talked to his dentist about what we're going to do, because the dentist, they are excellent with him. They are so good with him. And we've already kind of had that conversation. So that's an important one. And then this is going to vary a bit depending on where you live, but understanding guardianship. We do have some legal sessions that touch on this, and I think we'll probably be doing another session around this topic later in the year, but understanding how does guardianship work, where you live, what are the different levels of guardianship? So what are the different options, and start to understand how to pursue those. You don't want any of this to take you by surprise. That will totally undermine your advocacy of a young adult or a teenager, if some of these things take you by surprise. So just wanted to throw in those points, make sure they weren't missed. I think the other thing is that you could have, multiple sessions about each of these points. There's so much there. Excuse me. And that was kind of the difficulty with planning this session, is there's just so much we could talk about. So it's hard to just touch on that and then move on. But if you have any specific questions about it, please put them in the Q&A. Okay, so for practical pointers, we're really going to talk about 3 areas where you would want to apply these types of pointers. And if you think of any additional ones that you think would be helpful for the group, please put them. I was going to do a polling question about it, but please just put them in the Q&A or the chat so I can read them out to people. So we're going to look at practical pointers, tips basically for medical appointments, like routine doctor appointments, ER visits, and inpatient hospital stays. And there's Matthew with our own Dr. Sid, who is an exemplar of what a champion can be. He's an amazing doctor and helps all of our families and our kids. So for medical appointments, that we're going to talk about before the appointment, during the appointment, and after the appointment. So really, what are the tips and pointers that can make you a strong advocate for just a regular, a specialist appointment or a primary care visit, whatever the case may be. Something that people don't necessarily think about is the time of day that the appointment is. So if you make your appointments early in the day, that's like the ideal. Get there early, be the first one. You're not going to have to wait. Waiting for Matthew can be really hard. Maybe he starts in a good mood, and then by the time we get in, he's grumpy because we've waited so long. You also are going to have a doctor who's fresh and ready for the day, right? I know for me, in the morning, I can plow through work and get things done. And in the afternoon, I'm a little tired, right? So it's the same with doctors. If you can't get the appointment early in the day, first thing, then right after lunch is also a good time, because usually they're running on time right after lunch. When I call and I get like a 3:30, 4 o'clock, I'm like, oh gosh, here we go, because it's late in the day, all the staff they can still be doing a good job, but they have in the back of their mind that it's almost time to go home. And often they're running behind by a lot. Sometimes we waited 90 minutes recently for the doctor to come into the room, because all I could get was an 11:30 a.m. appointment. And so the whole morning delayed, right? Anything that delayed the morning, then we were on the kind of receiving end of. So that's something you can do right away to sort of set yourself up for success. Gather data to bring to the appointment. If you're seeing a GI doctor, for example, for the first time, do a food journal ahead of time, or even ask them, call and ask, what are some things I could bring and do ahead of time for this appointment? Because a lot of times with a specialist, before they're going to do anything involving medications or if they want any kind of testing, they're going to have you go and do some changes to environment, routine, et cetera, or gather information. So you can kind of speed the process up a little bit by doing some of that before you even have the appointment. So it could be a food journal, or if you're seeing someone about sleep, maybe putting some sleep hygiene practices into place before the appointment, like bedtime routine, sound machine. You can look online about sleep hygiene, but that's often what they're going to suggest you do after that first appointment, and then come back for your second appointment. So this just could save you some time. An allergist, thinking about logging environmental triggers or that type of thing. So keeping track of some things ahead of time. It's a good idea, if you can, to do some prep the night before the appointment, especially if you're going to a hospital where you're dealing with a parking garage and, walking through from the parking garage to the hospital and then having to check in. It can take a while. So, get a bag together the night before, lay your things out, set your coffee pot up, whatever the case may be, to help you get out of the house on time or early. Look at your maps, look at your Google Maps the night before and make sure you know with traffic, how long is it going to take? Because you really don't want to be running late, especially not if it's your first appointment. Excuse me. We have some examples of these too, which I'll send out after, but bring a one pager for Matthew, I keep on it. I have his name and his birthday on the top, and then his current weight and height. I try to keep that updated. All of his diagnoses listed out. I do include the ICD codes because I feel like it's good to have that, but you don't have to. I have all of his meds listed out with his current dosing because it's a lot. And when they start having you go through every medication, it's much easier to just hand them the sheet and they can put it in themselves. So usually they want to know the dose, the frequency, whether it's oral, or whatever the case may be. I have his doctors all listed, their name. I used to have all their phone numbers, but I don't do that anymore. I just have their names, his school information, his pharmacy. They often ask for the preferred pharmacy, right? His dentist, all of that stuff. So for me, I use a piece of paper. Some people like to do that in an app. I'd be curious if you all do use an app, if you wanted to throw the name of the app in the chat. I'd be interested to know what you use. There's families that do like to use apps, or even some people take advantage of the portal, their hospital portal. For me, I really like to just have it all on a piece of paper. It's in Google Docs. I can update it, print it out, no big deal. Okay. You could also, this is sort of along the lines of gathering data before the appointment. You can also ask before the appointment, are there any labs you're going to order and could I get them done first? Because that could save you then having to make a follow-up just to discuss the labs. Often they'll order the labs and then make you come back in a few weeks to talk about the labs. Sometimes this won't, they'll say no, that's not their policy, but it can't hurt to ask. I like to try to write down questions ahead of time, but I also find that questions come up while I'm talking to the doctor. So I always bring a notebook. Some people like to write in their phone and do things on their phone, but I always bring a notebook that I can write questions down as they pop into my head and also take down notes if I need to. I'm going to share with you at the end of this our QR code card for PMS 101. So you can see that, but that's something you can bring with you. And share with doctors to help them better understand the Phelan-McDermid syndrome diagnosis. So that would go into this the night before, print out any resources you want to bring. You could bring our clinical consensus guidelines. If you're starting to think your child might need medication for some kind of behaviors or for psychiatric issues, you can bring our pharmacologic recommendations. So I'll send you all of those resources in my follow-up email. Okay, so that's before the appointment. Anything to add, feel free to throw it in the chat. Let me just check here. Okay, so there we go. The chat is working, but I don't see anyone's comments in there. That's okay. All right, so during medical appointments, here's tips and tricks, pointers to help you be a good advocate during the appointment. We've talked about this already, but bring someone along with you to help so that you can be the best listener that you can be and also a good reporter. They're going to ask questions about, when did this symptom start or how severe is it? And it's a lot harder to think of, really think about the timeline of things if you're distracted by your child. I think that's also an important thing you can write down ahead of time. So if Matthew, for example, recently went through a period of illness where he had a virus. I don't know what it was, but he had an ear infection after it. He had conjunctivitis from the virus, and then he was better. And then he was limping, and then he stopped walking suddenly, very suddenly. And he actually just went back to school yesterday after a month. He was home for a month. He was in the hospital for 3 or 4 days. They were trying to figure out what was going on. And there's been so many times throughout this, now it's, a month-long period, we've seen physiatry, we've seen orthopedic, rheumatology, we've seen a bunch of different specialists, and they want to know what happened. They want to know the timeline. And uh, it's really a good idea to write it down, right? Whatever the symptoms are, write down the date it started, when you noticed it got worse. If you have, sometimes I look at my text messages to help me remember, oh, I know I texted my mom about it that day, so let me find when that text was, and that'll give me a date, right? So if you can bring all of that with you, that would go back to the before the appointment. But if you can bring those types of notes with you, that can be really helpful too. I like to keep his height and weight on hand because then they don't have to get him out of his chair and make him mad and measure him. I mean, sometimes they say they still want to, but usually they just take my word for it. If your child does not like their pulse ox and BP taken, you can ask, can they do it at the end? Sometimes they won't even do it, it depends, but that can really make Matthew mad. If the blood pressure cuff, he hates it. So I would ask them, can you just do it at the end? So we don't upset him for the whole appointment because, you might be there for a while. It's really important to follow the clinic rules. So don't be late, if they have cancellation policies, or if they don't want you on your cell phone talking in the waiting room, all of that stuff, just to be a good customer, basically, right? And be respectful on their side because you're expecting them to be respectful to you. You have an idea in your mind what you're trying to accomplish with the particular visit. That's important for sure. Why are you there? Make sure you know how to communicate after the appointment in case you think of other questions or have an issue that you want to ask them. A lot of times I'll think of something right when I leave. And for most of Matthew's doctors, then it's my chart. I can message them. So just make sure you know how to communicate with them best. There are definitely visits that can be accomplished virtually. So if you're just doing like testing results or follow-up, ask them if you can do a telehealth and save yourself all of the time and energy of having to go in person. It's okay to ask about how to pronounce things or what something means. The doctors might not know how to pronounce Phelan-McDermid syndrome. So it's okay if you're not sure, you can ask for clarification. I always like to restate the next steps at the end of the appointment. So, okay, we're upping this medication and we're coming back in 3 weeks. We're getting blood work done. Make sure I understand what the next steps are. A lot of times they'll print them out and give them to me, but I still like to try to say it myself to make sure I really know what we're trying to accomplish. And then after the appointment, communicate any questions or concerns right away, anything that comes up. And if you don't feel confident or comfortable, get another opinion. That's okay. We've had different doctors where we've gotten 3 opinions, and it's okay. It's not going to hurt someone's feelings. You have to be comfortable and confident with the care that your child is getting, and we can go back to that point about trusting your gut, right? All right. So for ER visits, a lot of the same points would be in play, but there are some different considerations as well. So these are tips for ER visits to help you really be able to advocate and be the best advocate for your child you can be. I like to ask the primary care, who's that care quarterback, to call the ER ahead of time and let them know that we're coming. And that usually they bring him right through and triage him right away, which just is nice. It can save time and just make the whole process a lot more streamlined. If we're going to the ER, I pack like we're staying there. I would pack like we're staying a night or even 2. I bring his tablets and his chargers, bring myself things to keep me comfortable. Because I find, at least with Matthew, once we go in, he's going to be admitted, and then they're going to want to keep him a while because they always, have different criteria of admitting and discharging, but he usually fits into those criteria for staying. The 1-pager we talked about already, so bring that with you. So you could even keep a copy in your glove compartment. Bring your child's prescription bottles because they're going to ask you all about that, and sometimes it depends on your hospital policy, but if you're, if he or she has to have medication at a certain time, then you have it with you, and you can talk to them about whether they'd rather provide the medication or you, but it's a good idea to bring it with you. If you're not comfortable with someone, it's okay to ask someone else to perform the procedure. When we were in the hospital last month with Matthew, he'd been through so much during those 4 days. He had a 2.5 hour sedated MRI for one thing. He had countless blood draws, x-rays, ultrasounds. And, he hates it all. He did really well, but he doesn't really understand why they're doing all of that to him. So by the last day, they said, did he want to have a flu shot at discharge? And he hadn't had his flu shot. I don't know. It would have been long enough that I said, sure. And so the nurses came in to do the flu shot, and the one nurse was saying to the other nurse, okay, so you take the needle and this is what you do. And she's demonstrating to the other nurse, who looked like she had a student nurse badge on. And we go to a teaching hospital. That's what it is. And that's great. I mean, I think it's excellent care. It's a Johns Hopkins hospital, but he'd been in the hospital for 4 days and we were about to go home, and I didn't want someone hurting him with the flu shot who had never given a flu shot before. So I said, can you please give him the shot? And I addressed the main nurse, and she said, of course. And that was that. No big deal. I don't think it hurt anyone's feelings, and he was able to quickly get his flu shot and go home. So it's okay to ask for someone else. There's times from when he was a baby that I can think of that I wish I'd spoken up and asked for someone else. But now I feel more confident doing that. Everyone you interact with is a chance to build rapport, educate, advocate, any person you interact with, whether it's the person cleaning the room, bringing the food, or the head doctor. So just keep that in mind. Okay, so for inpatient hospital stays, now you've been admitted. Now this might look different if it's like full-on crisis, psych crisis, or something like that. But in general, you're really wanting to build those relationships with the doctors and nurses. We talked about that earlier as one of the strategies for learning, as an advocacy skill, is building those partnerships. Ask them how they're doing. How's your day? Try and build that rapport with them, because it will help you if there's something you need to ask of them regarding getting testing done or expediting things. Ultimately, it will help you to have a good, positive relationship with those doctors and nurses. We find that if we're able to build good rapport with the nurses, sometimes they help us. If the techs come in the night and want to, do all his vitals, the nurses will say, oh, come back in a couple hours, he's sleeping. We find the better rapport we have with the nurses, the more we get those types of things are a little easier on him. Ask for the discharge criteria. So what's it going to take to get discharged? For sometimes they want to see the child poop. They want to, in this case, when Matthew was there, this is him in the hospital last month, they wanted him to be walking or at least able to bear weight. So you want to know the discharge criteria so you can kind of work towards that. I skipped this one. If you're not sure how something's being handled, ask to see the policy. What's the policy? Can I please see that in writing? If it's a hospital policy, they have to be able to give that to you. For discharge also, you want to clearly communicate your child's baseline, because if they want him eating, for example, that's been something with Matthew when he goes in for cyclic vomiting episodes. They want him to be able to leave eating and not vomiting. We have to tell them, his baseline in a hospital, he's not going to eat a full meal in this setting. He has autism. He's got to be home in his seat to eat his meal. So his baseline to leave would be more like eating an icy or having a couple bites of his yogurt. He's not going to be eating a whole meal. Sometimes you can have multiple tests done at once. So if they're under sedation, ask them to do the blood work also, or if there's testing you've kind of been waiting on and they're going to sedate the child for other testing, see if they can lump the things together and get as much over with at one time as possible. You can ask if there's comfort measures available for your child. Versed is one that's often used, or, are there numbing agents to help with IV insertion? Things like that. This one's a big one for me, knowing your hill to die on. So what are the things that you are not going to let go and that you are going to push and advocate for? And then what are the things that maybe aren't so important to you? So you're not going to be able to win every battle. But knowing in your mind what are the most important things can be very, very helpful. Bring some things with you to help you look and feel like a human. I like to bring like makeup wipes, face wipes, things like that. Know how to get food and coffee, because that's going to just help you be a better advocate and a better communicator if you are not super hungry and if you're caffeinated, or if you're someone that drinks coffee. If you have someone that you can trade out with, we take 24-hour shifts with Matthew, and that keeps us just from burning out at the hospital. 24 hours is a good amount of time for me and my husband. Things will get bumpy. There are going to be roadblocks and things that come up. So, first of all, if it's in a conversation or in the moment, just pause and breathe and focus on the facts at hand. Take your time explaining things. If you have to take a break, that's okay. You can just say, I need to go have a bathroom break. I just need to get up and walk around for a minute. I just need a break. State your concern. So ask questions and state whatever the concern is. And again, if you're not sure about how something's being handled, ask to see the policy. Even in follow-up afterwards, ask to see the policy. You can speak with the management of the clinic. So there's going to be like a supervisor of either the hospital department or the clinic who you can talk with about your concerns. You can ask for the hospital's patient advocate to help you and discuss the concerns with them and see if they have suggestions on how to move forward. If you have kind of exhausted all of those options, then seek a second opinion and switch providers if you're not satisfied with the outcome at the original provider. If you believe the law has been violated, then you can file a complaint with your state's Department of Health. Every state has a pretty easy way to do that. If you need to get a lawyer involved, that would probably be somewhere around that time. But there's always another next step. There's always a path forward, and you don't ever have to accept the outcome as it is. You can always figure out another way. We're happy to support you, if you have questions about working with a hospital advocate or how to get the policy, things like that, just reach out. We're here to support you through those things. Something that comes up and you might have heard about is this concept of medical gaslighting. So I just wanted to touch on it briefly. This refers to medical professionals dismissing, ignoring, minimizing, invalidating the caregiver concerns. It's different than like the psychological term gaslighting, which is intentional. Medical gaslighting is not always intentional. Sometimes, doctors really are trying to help and they want to reassure the parent that things are okay. But really the parent knows their child best and their concerns should be taken seriously. This is a pretty common issue faced by our families. It's probably something you've experienced at some point, is that feeling of being dismissed, not listened to. But it can have negative emotional consequences, and it can have practical consequences on the care of the patient. So it's important to just be aware of this. It goes back to that concept of balancing trust and skepticism, and that's why I really wanted to include that point about sometimes this is happening because the doctor is trying to make the caregiver feel better. It's not necessarily an intentional or malicious thing. I did a survey about this with our families back in the fall because I spoke on a panel with Global Genes at their conference about medical gaslighting. And these are some of the quotes from caregivers that if they hadn't had this experience of medical gaslighting, like for example, this one said, I could have saved my child's life, that they no longer trusted medical professionals. I might have made a different decision about having a third child. So there can be some really real consequences for families and for the patient, for the child. So just, keep in mind, if you do feel like you're being dismissed and not listened to, if you're hearing things like this from doctors, these are some of the quotes from doctors, that she's fine, they're slow paced, you're neurotic, He's just quiet. Don't compare him to other children. He's a lazy baby. Stop worrying. All of those types of things. That's when you might want to seek another opinion. Push back, don't just accept those answers if it feels off to you. And then these are some of the positive outcomes of being a strong advocate and, maybe having to push hard to get your child what they need, but just feeling stronger, becoming more determined. I refuse to not be heard. I've learned to call the shots and be direct in managing care and the physicians I entrust. I stood up more than I've ever done, and now I question everything. It made me stronger. So it's just some quotes from caregivers about how advocacy has empowered them. And I really hope that some of the points from this session help you to feel stronger and like a more determined advocate. Okay, so quickly, I just want to share with you our new QR cards. These were brought up in our January pathway session, and I sent out a bunch of cards to folks who came to that session to pilot them, and then we took their feedback and adjusted the cards a little bit. So these are available now on our website. You can download them and print them yourself, or you can have the QR code in your phone, like save it in your photos. And then when you're at a doctor's appointment or at the hospital, they scan this code and it brings up a ton of resources and information about Phelan-McDermid syndrome. So on the back, this would be more for like if you're in the grocery store and someone's asking about your child's diagnosis or staring and making you uncomfortable, you can use these codes as well, which are a way to join the membership. There's a donation one and then about Phelan-McDermid syndrome. So these are really, really great. I used them when we were in the hospital with Matthew. One of the things that pops up is the medical advisory on anesthesia. So when he had that sedated MRI, I had the anesthesiologist scan it, and we sat there and looked at the medical advisory together. So she then told me what anesthesia meds were being used, and she thought it was great. So it's a great resource. So I'm going to send this out to you all. Give us feedback on it. I'd love to hear, when you use it, what you think. But those are our QR codes on it's PMS 101. And then we also have a neuropsych card. So it's the same idea. And this one is all of our neuropsych resources. So when I send you the link, you're going to see this one as well. Same concept. Okay. And that's me in front of the ER with my QR cards ready to go in. I just wanted to highlight for you our next pathway session is going to be in April, on April 22nd, which is Matthew's 10th birthday. It is puberty, menstrual management, and women's health and Phelan-McDermid syndrome with our own lovely Lori Levi, who is a retired OBGYN and mom to Rachel, who's her adult daughter with Phelan-McDermid syndrome. And she's also on our board of directors. So she will be speaking. It's going to be a great session. I hope you guys can make it. That's it, you all. Thank you so much for joining. I hope you have a great day, and don't be a stranger. Reach out if you need anything or if you have any questions.